Hello, students, how are you? In this video, I'm going to talk about the hyoid, infrahyoid muscles or strap muscles. These muscles are attached to the inferior border of the hyoid bone. So these muscles are four in number and their names are omohyoid muscle, sternohyoid muscle, sternothyroid muscle, thyrohyoid muscle. These are four in number. These name appears to be problematic. Actually, they are not. They are very quite, sensible and quite helping in making you understand the concept and attachment of these muscles. These muscles are very simple to understand. So we will go through all these four muscles one by one. First of all, omohyoid muscle. Omohyoid muscle. So this word has got omohyoid has got two parts. First is omo and other one is hyoid. Omo for scapula and hyoid for the hyoid bone. So here we are with the muscles. Look at this muscle. This muscle here. This is omohyoid muscle. This muscle has got two bellies, two fleshy parts. This is inferior belly here, inferior belly of omohyoid muscle. Then we have got intermediate tendon, then superior belly of omohyoid, which moves upward and attached to the inferior border of the hyoid bone. This is hyoid bone. So this is the reason this muscle has been named as omohyoid. Omo for scapula because they attach to the superior border of the scapula adjacent to the suprascapular notch. Omohyoid. So this is intermediate tendon. So very easy. Omohyoid from the scapula and hyoid. These are muscles are, as we talked about, four in number. They are present in two layers, superficial layer and deep layer. These two muscles, omohyoid and sternohyoid, these two muscles are muscles of the superficial layer, whereas on the left side of the image, on my right, obviously I'm looking at this structure on the screen, but actually this is left side of the subject. So here you see same muscles, omohyoid and sternothyroid, have been removed to show you the deeper muscles, deeper structure, which we will talk about later on. So first of all, omohyoid, as I hope you have understood why it is called omohyoid, and it has got two bellies, inferior belly and superior belly. Now the second muscle is sternohyoid. Sternohyoid because this muscle is attached onto the posterior surface of the manubrium, and clavicle. This is manubrium. Manubrium is a part of sternum bone. So it attaches onto the posterior surface of the manubrium plus few fibers from some parts from the posterior aspect of the clavicle as well. And the strap-like muscle, these are also called strap muscle. Strap-like muscle moves upwards and attach onto the inferior border of the hyoid bone here. So this is the reason this muscle spans between, gets its origin from the sternum here, manubrium, which is a part of sternum, and its distal attachment or its other attachment is onto the hyoid bone. So that's why this is called sternohyoid. Omo for scapula and hyoid. So these were the two superficial muscles. So on the left side, look at this thing. This same two muscles, omohyoid and sternohyoid, have been cut here, and this is sternohyoid muscle have been cut, and in between, the part in between has been removed, and this is cut belly or superior belly of the omohyoid. So this is inferior belly, this is intermediate tendon, this is omohyoid. And here it has been, these muscles have been cut, a portion of these muscles have been removed just to make you look at the underlying structure. This is sternothyroid. This is thyroid cartilage. Thyroid cartilage. Thyroid cartilage in males it is quite prominent and it is called Adam's apple. It has got two laminas, right lamina and left lamina. On either lamina we have got oblique line on the thyroid cartilage. So this muscle, which is called sternothyroid, it arises from it is much broader than its overlying structure, which is, look at this thing, this muscle is sternothyroid. It is less broader as compared to underlying structure, which is visible here, which is sternothyroid is broad as compared to sternothyroid muscle. So the name of this muscle is again very obvious. This muscle has got two attachments. One is on the sternum and other is on the thyroid cartilage, oblique line. So this muscle have been named as sternothyroid. So this sternothyroid, this muscle is the only muscle which doesn't reach to the hyoid bone directly, rather indirectly. Look, it gets attached over here. And this belly, muscle belly, it actually crosses the thyroid gland. Here you see, this is thyroid gland. Isthmus of the thyroid gland, half of the thyroid gland is just beneath right and left sided sternothyroid muscles. So then muscle gets attached onto this thyroid cartilage oblique line just above the thyroid gland. So whenever there is enlargement of the thyroid gland in case of a goiter, this enlargement or enlarged thyroid gland cannot move further beyond this point because it is inhibited by the attachment at the thyroid cartilage of sternothyroid. It limits its upward extension, thyroid gland. When it becomes enlarged, enlarges considerably this your thyroid gland, but its upward extension, upward enlargement is prohibited by this attachment. And then we have got fourth muscle, which is called thyrohyoid. So again, from the oblique lamina on the oblique line on the lamina right and left, we have got attachment of the muscle which is called thyroid for the thyroid gland and hyoid for the hyoid. So this muscle is present between the thyroid cartilage and hyoid bone, so that's why it is called thyrohyoid. Again, this thyrohyoid muscle, this smaller portion, thyrohyoid, it has been considered the continuation of sternothyroid muscle, which is moving upward and get attached. From there, thyrohyoid moves upward. So actually this thyrohyoid muscle has been considered as an extension of this muscle. Now, these are the four muscles which are strap muscles. Again, I would go with the quick review. These are, first of all, omohyoid, inferior belly, superior belly, in the tendon in between, which is intermediate tendon, and it is inferior belly attached onto the superior border of the scapula, adjacent to the suprascapular notch, which has been concealed by this trapezius muscle. Because of trapezius muscle, you cannot see the scapula. Actually, it is beneath there. And superior belly attached to the inferior margin of the... Now, then sternothyroid from sternum posterior surface and hyoid bone, then sternothyroid from posterior surface of sternum and oblique line of the thyroid cartilage, and then thyrohyoid from oblique line to the hyoid bone. Now look at all these four muscles, which are strap muscles. They pull the hyoid bone downwards, and makes it steady. For example, as in case of swallowing, when larynx and this hyoid bone is elevated during process of swallowing, then these four strap muscles, they bring it down, they bring it back, they depress the hyoid bone and larynx. And here you see, and they study this hyoid bone for the attachment of the tongue muscles, suprahyoid muscles. Now I will talk about its, this is the again hyoid muscles. This is hyoid bone. Look at the structure. This is inferior belly of hyoid. This is intermediate tendon. It has been, this is facial sheath for attachment to the clavicle, intermediate tendon, then superior belly. It is attached to the hyoid bone, then sternohyoid from the back of the sternum and clavicle directly to the hyoid. Then we have got underlying sternothyroid oblique line behind the sternum, oblique line, and from oblique line till hyoid bone, thyrohyoid. So these are four muscles, and look at this, the thyroid gland, which is present just beneath the this oblique line. This sternothyroid muscle. Okay, this muscle prevents upward enlargement of the thyroid gland, because in case of goiter, because this muscle is attached onto the thyroid cartilage. Now its nerve supply. Here we are looking at the ansa cervicalis. Ansa cervicalis is a loop of nerve present on the anterolateral aspect of the carotid sheath. These are the structures here which are present within the carotid sheath, which are internal jugular vein, common carotid artery, internal carotid artery, then vagus nerve, and this is ansa cervicalis. This ansa cervicalis has two roots. This is superior root, and here we have got inferior root. And these are the, I will do another full-fledged video on this ansa cervicalis, but right now my consideration is nerve supply of these strap muscles or infrahyoid muscles. All of them are supplied by the ansa cervicalis except for thyrohyoid. This is thyrohyoid. It is supplied from the C1 through hypoglossal nerve. This is hypoglossal nerve. It supplies the thyrohyoid. So all the out of four, three muscles which are strap muscles or infrahyoid muscles, they are supplied by branches from the ansa cervicalis. These are branches, and this loop is called ansa cervicalis. They supply all the muscle except for thyrohyoid, which is supplied by C1 fiber through hypoglossal nerve here. So next I would be doing video definitely on this ansa cervicalis. Thank you very much. Please do watch this video.